Good afternoon, everyone. Myself, Dr. Sudeep. I am a consultant pediatric intervention cardiologist and fetal cardiologist at KIMS Hospital, Secunderabad and Kondapur. So today we are celebrating Congenital Heart Disease Week. So just as a to the public, what is the meaning of the congenital heart disease? Congenital heart disease means the diseases which are present since birth. Okay. So there's a lot of myth in the society about the congenital heart disease. In normal language, for the layman, the congenital heart disease is any hole in the heart is referred as congenital heart disease. But that is not the truth because there are so many other diseases which also comes into that category. But as a rule or as a layman language, any hole in the heart or wall problem which is present from birth is the congenital heart disease. So as I told, congenital heart disease is the disease which present from birth. So when the disease present from birth, then we have to see how to detect it. When the congenital heart disease week is still, the congenital heart disease is the second most common cause of infant mortality death in India. Okay, so you can understand how much infant mortality is contributed by the congenital heart disease, and in the neonatal age it's the fourth or fifth leading cause of the death in neonatal age. So with that, you can estimate that how much burden of the congenital heart disease is still present in the society. As a rule in any live birth in any country, instead of developing, developed or underdeveloped country, 8 out of 2,000 births are suffered from congenital heart disease. Out of that, eight, three or four are simple diseases, one or two are very complex diseases, and one or two are the diseases which very complex and nothing we can do for that. So how to detect that? The main importance will press on today will emphasize on this fact how to diagnose and when to come to know your baby or your child is having congenital heart disease, and you have to go to the pediatric cardiologist and pediatric cardiac surgeon for the further management. So there are two ways to diagnose. First, sometimes when the previous baby is having heart disease, or nowadays more TIFA or the fetal echo or the scanning in the pregnancies are done. If you are able to diagnose at that point from the beginning, we can know. But in that also 1 to 2% or 5% of the small problems we cannot tell. So still, once the baby got delivered or after birth, whenever any symptoms are there, you have to refer for the pediatric cardiologist. Pediatric cardiologists are the specialized cardiologists, like I am pediatric cardiologist, who is specially trained to treat only pediatric cardiac heart problems. And we have a team of pediatric cardiologists, pediatric cardiac anesthetists, and pediatric cardiac surgeon who are doing only surgery for the pediatric heart, nothing else. So you can understand this is a very specialized branch, and still there are a lot of fear in the public for the congenital heart disease. So I must say two things. Whenever these three, four symptoms are there, what are those symptoms? Whenever your baby are not gaining weight properly, the baby is having recurrent cough cold, baby is having bluish discoloration, having feeding difficulty. So these are the four symptoms during infant health. That means when the baby is small, 1 2 months, 6 months, 8 months. Out of these, whenever any symptoms are there, like feeding difficulty, weight is not gaining, repeated cough and cold, baby is getting admitted for pneumonia, and the bluish discoloration. In the older age group, like in the 4 5 years age, 10 years age, or 12 years age, if the chest pain and the giddiness, baby dropped attack, by the giddiness means drop while playing or while exertion, and chest pain which is not improved and which is more on exertion, these are the two other symptoms in the grown up age that suggested there is a congenital heart disease. Third thing, some baby don't have any problem, but while where they go for their vaccination or during their checkup to their pediatrician, then they found out some murmur or some abnormal sound, and then they come to know there is a congenital heart disease. So, in total, the ways by which the congenital heart disease, that means the heart disease which can present from birth, but which can be detected anytime. It may be detected at 1 month, 2 months, 8 months, 9 months, sometimes after so many years, but the symptoms are few which if at all present in your baby or any baby, you should consult pediatric cardio. Like again I'll tell, bluish discoloration, that means the lips and tongue are getting blue, so that is not a good symptoms. Blue baby, that is blue baby syndrome, and that is the one of the most common cause of the blue baby syndrome is the heart disease. So once that is there, you have to refer to your pediatric cardiologist. Second thing, recurrent cough cold. Although allergy, infection or other causes, but when it's not getting the treated normally, like in spite of giving antibiotic, admissions, and giving the oxygen, it's not improving, then that is the time you have to at least consult your pediatric cardiologist, so that because if the cause is because of the heart, it's not getting, so we can treat that. Third is not gaining weight. This is one of the very prominent symptom when the baby is not gaining weight in spite of good feeding. Mother is getting good milk, giving good feed, but in spite of that, baby is not gaining weight. That is also sometimes you have to think of whether my child is suffering from congenital heart disease or heart disease problem. Fifth thing, baby is having multiple cough cold episodes or pneumonia or getting admitted for pneumonia. Sometimes very good mothers who are very keen and observant, when they touch the baby chest, they found out that there is a something thrilling sound or the heartbeat is beating very fast. Sometimes when no symptoms are there, but if you are touching and you feel something thrill or some water like feeling in inside the chest, and the heartbeat is very fast, that is also known as palpitation, then in that case also you have to take consultation from pediatric cardiologist and pediatrician for to rule out congenital heart disease. As a thing, mostly all the general public are first exposed to the pediatrician and the general physician. So whenever these things are there, you can tell, "Okay, sir, this is not improving as per that." And if you can contact that pediatrician and then the pediatric cardio, you're able to detect the congenital heart disease in your child. First of all, this is not to scare anyone, but congenital heart disease, 80 to 90% of the problems are treatable. Out of that, 20 to 30% are curable. That means once you know and you do the correct time the surgery for your baby, the baby will have near normal or almost normal life. So that is very good thing. That is a gratifying result. The fear in the public like that kid, my child heart problem means it's a death, it's not there. So remove that fear. Any heart tissue or any heart problem or any heart disease having very poor outcome, no. At present most of the heart disease got the treatment for which the if you get treated by the two ways, what are the ways I'll tell later, the baby may have normal life. So what my uh, public, I am just telling, I am requesting the public, ki whenever you get symptom, don't be get fear, don't get feared by congenital heart disease. If you had congenital heart disease in your child or in you, directly consult your pediatric cardiologist and surgeon so that we can suggest the roadmap for you what to be done later. So now these are the one aspect. Second aspect, there are three types of the diseases. If you see congenital heart disease, the three ones are holes. Holes are things in the heart chamber, the communication in the heart chamber that is causing the more flow to the
Any
lungs.
heart
So that
tissue
is
or any
causing the
heart
repeated
problem
cough,
or any
cold, poor weight gain, excessive sweating, fast heartbeat. So in that case, there are two ways. Nowadays, with the advanced technology, we can still, in most of the some of the cases, we can do without surgery. Like we can put a like we are putting the small IV line, from that IV line through a small tube, we can put a button and we can close the hole. So the very latest technology from the few years, and even that technology we can apply to a 700 gram. Recently, in the last 6 months, we closed the hole in a 700 gram up to 1.2 kg, at least 5 patients, where without surgery, just by the vein of the heart and to the tubes of the heart, we can put a one tube small and we can put a device. So once it's a hole in the heart, there are two types of the treatment. Either you go with the device closer, but for that you need the proper margin. So if the margin is not there and hole is too big and the baby age is very low, and for which the hole is not for which the devices or the occluder or the button is not applicable, you have to go with the open heart surgery. Don't get feared. Most of the time, parents are not feared for the surgery, they are feared for the scar. So I'll tell you, cosmetic thing is secondary. Baby life is precious, that is main thing. So don't get fear with the scar. Scar will be there. In some cases, we can do from the side, so the scar may not be visible. Or in some cases, what I told, when the surgery is not needed, we can do with the device or button. There won't be any scar on the body. So this is the first type of disease and its treatment, like hole in the heart, which has got the connection between upper and lower. So there are three types: ASD, VSD, PDA. There are three types of the holes and AP window, which can be closed either by surgery or, if possible, by the device closer. So once you diagnose this, you have to consult your pediatric cardiologist and the surgical team. Seconds are the wall problem. Some walls where the from the heart chamber, the heart chamber will pump in through the tube, the heart chamber will push blood to the whole body. So that wall, the tube and the chamber, there's a wall in between. Sometimes that wall normally it opens like this, but if it's not opening, it's a stenosis or it's a blocked. Have to do the balloon opening. You have to do the opening. It will be very excited to share with you कि even in the fetal age when the mother is pregnant, if you diagnose that block, even you can dilate at that point, or even after birth at the age of 1 or 2 days also, in that baby also you can able to open the valve. So whenever the valve is open, again the symptoms are same. The breathing problem, baby required, a very sick baby required breathing problem, excessive crying, requires ventilation, requires oxygen. So when the wall block is there, you can go either with the balloon. In most of the cases without surgery we can go with one of the vein and we can open the wall with putting the balloon, and then open the balloon, then release the balloon and remove the balloon, and the wall will be opened. So this is the second type of treatment. Third is the cyanotic baby. Cyanotic baby is having complex problem. In those baby there is a hole also and there is a block also. Both things are there. Or some cases there is a block in the tube which is supplying the heart. So all those, whenever the blue baby is there, most of the time the only thing needed is the surgical correction. Okay, so that needs surgery. But for the general public, I must say, and I am requesting, whenever you think of blue baby, don't think all babies have bad life. 90% of the blue babies got the very good life, like a near normal life. They can do all the work what a normal people can do. But for that, you have to get operated as early as possible, or when the correct time comes as per your pediatric cardiologist advice. So there are three most common type. Other three, four common types are also there, like some liver problem which is causing the heart problem, or some lungs pressures are very high. For that specific treatment is present. So you have to go to your pediatric cardiologist and the pediatric cardiac surgery team, and then you have to take the opinion. Here it comes, we are proud to say that we are treating at least 60 to 70 baby per month, 20 to 30 for surgery and 20 to 30 without surgery, like blockage of hole or opening of the wall. We are doing every month, and we are getting very good results here because we have the very good team of pediatric cardiac surgeon, very good pediatric cardiac anesthetic team of pediatric cardiologists, as well as the whole nursing staff, as well as excellent infrastructure. So in Congenital Heart Disease Awareness Week, I must say, don't be scared of congenital heart disease. Congenital heart disease mostly is, we can conquer it, but we have to come at the normal time. One of the very sad thing being a pediatric cardiologist, we are seeing the sometime when we are telling mother and parents that the baby needs surgery, at that time they may not having much symptoms or much problem. So they thought that doctor is just saying like that, sir, why my baby is not having any problem, and they miss the time. And sometimes they come after 2 3 years when the child is not in the operable condition. So my request to you as a general, to this is a message to the general public on congenital heart disease: don't get deviated by the talks of the nearby people, those who don't know the subject. Take the advice of the proper pediatric cardiologist to get when my child needs the surgery. So don't get influenced by the nearby relatives or people. Oh, that is not needed. See, baby is not having symptoms. Why doctor is telling it to go for surgery or for the device closer or the button? Don't get influenced by that. When you properly come to the pediatric cardiologist, we can tell you that this is the time it need to go for the surgery or for the button or for the balloon. So because once you lose the time, we have so many instances and incidences where they not taken any treatment. When they come, they regret it. The parents and the relatives regret it. They not taken proper action in spite of doctor telling to go at that point. The baby was fine for few months or years, but after that they got died, the baby died, or they are come into the that stage where the surgery is not possible. So my, it's a general appeal and request to the whole public कि when the congenital heart disease is diagnosed, don't sit at home, take a proper advice, and whatever the doctor give you advice, follow that advice. So my message to the congenital heart disease week to you: don't get scared of congenital heart disease. It's a curable in most of the cases and treatable in most of the cases, and no need to get scared. And with the present technology and present infrastructure, it's possible to almost conquer most of the congenital heart disease which may lead very satisfying life to the parents, and which may lead to the normal life, near normal life, to the sufferer or to the patients. So congenital heart disease weak, this is my message. Whenever 5 6 symptoms, not gaining weight, fast heartbeat, mother notice, or some abnormal sound notice, not gaining weight, recurrent cough cold, excessive sweating, bluish discoloration, chest pain or giddiness or drop attack, all those things, when they are there, try and please come to a pediatric cardiology consultation and try to know, okay, what is the problem with the child. And because so many of the diseases are treatable and curable, so we can advise you exactly and properly what is needed at that point. So don't be get feared. And most second thing, don't get influenced by the people who don't know the subject or don't know the nearby people, because so many times the nearby people influence you. So don't get influenced. Whatever, wherever hospital you go, there are good hospitals having pediatric cardiology consultations in the city and in the India. So go and come to us so that we can give you the proper advice and the treatment. So what my message to you on the congenital heart disease, we can conquer congenital heart disease if the proper time referral is done and proper time treatment is done. So, whenever these symptoms, again, I'll repeat again and again, bluish baby, teeth, lips, and are going blue. Second thing, abnormal sound or the fast heartbeat. Third thing, not gaining weight, recurrent cough cold, and drop attack chest pain. So whenever these 7 8 symptoms are there, or whenever you're diagnosed, or when you're referring doctor, you go for vaccination, they found out some abnormal sound. So come to pediatric cardiologist, come to us. We can guide you very well in, and we can guide you how your child will live a near normal life and a satisfying life. Thanks a lot. Please. Any questions? Anything? They can. It's just the recording, na?